You typed your symptom into Google and then everything went dark. Cancer, tumor, rare condition, immediately. And now you're sitting there, heart racing, wondering, did I just find out I'm dying? Hi, I'm Dr. Sylvia, an NHS GP and women's health doctor. And today we're going to talk about 3 symptoms that send women straight to Dr. Google and straight into panic mode. And then I'll tell you what I, as an actual GP, am actually thinking and checking for when you come in with those symptoms. Did you know Google has a name in medicine? We call it cyberchondria. It's the spiral that happens when you search a symptom and the algorithm keeps showing you the worst case version because that's what gets clicked. It's not lying to you. It's just not designed to carry the symptoms together and provide you the guidance or reassurance that you need. It's designed to keep you scrolling. I've had patients coming in absolutely convinced that they had ovarian cancer because they'd experienced bloating for 2 weeks. And I've had women come in because they were convinced they had cervical cancer because of one episode of bleeding after sex. Now, should they have come in to see me? Absolutely yes. Should they have arrived thinking that they were terminally ill? Certainly no. And that's the difference I want to make for you today. Symptom 1 is bleeding after sex. You Google bleeding after sex and cancer is the first result that pops up. Every time. But here's what your GP is actually thinking, depending on all the other symptoms that you also might present with. First, a cervical ectropion. This is incredibly common, especially if you're on the pill. The cervix, the neck of the womb, becomes slightly more delicate and it bleeds a little bit when it's touched. It is benign. It doesn't become cancer. We see it quite commonly. Another possibility is a cervical polyp, a tiny, harmless growth on the cervix that bleeds on contact. It's usually removed in a quick, simple clinic procedure. It's not cancer. Third, a sexually transmitted infection like chlamydia. It is treatable with antibiotics in one go. Now, yes, in a small number of cases, bleeding after sex can indicate early cervical cancer changes, which is exactly why I want everybody who has that symptom to come in and see me to get checked, not to panic. Your GP will examine you, check your smear status, and often can tell you on the spot what they think they're looking at after examining. Google can't do that. Symptom 2, pelvic or lower abdominal pain. You Google pelvic pain in women and you're suddenly reading about endometriosis, ovarian cancer, and rare tumours. Here's my actual differential when you sit across the table from me and depending on all the other symptoms you come in with too. First, irritable bowel syndrome. It's genuinely the most common cause of pelvic pain in women. Now, the gut and the pelvis share the same nerve pathways. What feels like a gynecological pain could be a bowel pain. Next, ovarian cysts. Most are functional cysts that form during ovulation and disappear on their own within a few weeks. We confirm them using an ultrasound scan. Most don't even need treatment. Another is endometriosis. That's real, underdiagnosed, and worth investigating. But it presents with a very specific pattern, pain that follows your cycle. And yes, of course, ovarian cancer is on the list. But it's at the bottom of the list, not at the top, because it's less common. And your GP knows how to work through this systematically so nothing gets missed. Symptom 3, a lump you found. You found a lump somewhere and Google has told you it's a tumor. Now, if that's you, I want you to breathe for a second. Most lumps women find in the vulval area are Bartholin cysts, blocked glands. We've talked about these a lot on this channel. They're common, mostly harmless, and very treatable. Sometimes they do go on to become abscesses and they can keep coming back. While that is troubling and does have treatment, it's not cancer. A lump in the lower abdomen could be a fibroid. 1 in 3 women has fibroids. Most of them never know. A swollen lymph node in the groin can appear during or after an infection, even a minor one that you didn't notice. The point is, a lump needs to be seen. But needs to be seen is not the same as definitely cancer. That translation is what Dr. Google gets wrong every single time. So what do you actually do when Google sends you off into a spiral? 1. Write your symptoms down. Exactly what, where, when it started, how often. That list is gold for your GP. 2. Book the appointment. Not in 2 weeks when the anxiety has snowballed and convinced you of the worst. This week. 3. Tell your doctor you've been Googling. We won't judge it. I promise we don't judge it. We'd rather know because it helps us understand what you're worried about and we can address that concern directly. And you deserve answers that come from someone who can actually examine you, not an algorithm that's optimized from your fear. If today's video helped calm one panic spiral, please tell me in the comments below. Drop the symptom you Googled that sent you off into a spin. I read all the comments and I want to know if there's a specific one that we need to cover next. If you're someone who hasn't had their smear test because fear got in the way, I have a full walkthrough video that takes you through step by step everything that goes on in your smear test appointment. I'll place the link in the description box as well. It's exactly what you need before you go for your appointment. Let me know how you get on and I'll see you again soon.